Welcome to Public Safety Committee meeting. We are joined today by my colleague Pat Hogan, my colleague Martin Ave, and Michelle Majuk as the chair. We are also here joined by Director Latif. Kinsey Johnson, welcome. And Dr. Anita Wright and members of his team are also here. We are here to discuss On Point for College contract and the extension that need to be done to it. And in midst of that, we want to hand it over to Director Latif to give us an update on where we are with the program and with the project, and we will follow everything else with questions, or at least maybe if anyone has questions in the middle, we can pause and have them be answered. But take it away, give us some updates of where we are with the project,
Okay.
and then we'll follow with questions.
Okay. Good morning, everyone. I'll start with just so we kind of give like a overview of Safer Streets and where we are with the ARPA funding. So we know that Safer Streets is more than just ARPA funding. We have the DOJ contract. We have the coalition that we meet monthly with, 2 times a month with, which the coalition is with county partners, state, and federal partners. So most contracts were signed as of September 2023. We amended them in October of 2024. Couple things along the way with different organizations. They updated their contract. They had some reallocation. And all the contracts besides On Point expired March 31st, which was last Monday. What brings us here is the abrupt interruption of contract by Project HEAL. I want to make this to remind everybody, that's kind of why we're here. We contracted with Project HEAL, they abruptly stopped. That brings us to this point now where we now talk about bringing in an On Point. So we amended and brought in Project HEAL October, November 2024. A letter was submitted for ordinance and reallocation of funds to On Point as of November 1st. We finally received a council request for funds and transfer on November 6, 2024. Council adopted it in legislation on November 12, 2024. Then we go through the transition of bringing On Point on, and the contract was signed by, and I think one of the issues we had with this, the time, is that you have 4 or 5 subcontractors that have to sign with On Point. So even though we sign with On Point, you have 4 or 5 therapists that have to sign on with the organization, which takes time because you got to get all 4 or 5 of them to agree to a contract. They signed that on the, well, let me just back up. The fully executed contract was done on January 21st, 2025. That's the fully.
So all the therapists have subcontract.
Yes, sir.
Okay.
Yeah.
Okay.
So, and they signed theirs on February 8th. I see Dr. Wright and the other therapist signed on February 10th. So we really didn't get to work until mid-March. So that's why we're here today to get the extension, because it took some time to get a contract set up. And again, it goes back to the abrupt termination of services that threw us off. We probably wouldn't even be meeting right now, you know, but by us having to stop and try to get a contract with a new organization, that took some time to bring us here where we are today. So as of today, and I'll let Dr. Anita speak, we're probably working with 9 to 13 individuals. Now, we say we have 50 individuals, right? Well, as of the 31st, we couldn't carry on with 50 individuals. So what we started doing back in February is really shortening that list on who's most needs that therapy, need that therapeutic piece, and who's doing well, who's working. We got guys that are working now, guys that have not been in trouble. So when we make those decisions, with SPD and also with probation on who we should continue to give services to. So that leads us to today where we are now. with the 9 or 13. And again, I'd rather get the numbers from Dr. Anita, who she's working with at this time. And that's where we currently are.
So with Project HEAL,
Yes, sir.
them abrogating their contract, where do we stand as far as the money goes? I mean, do we pay them money or?
So when Project HEAL abruptly stopped, their contract stopped. We don't pay them anything.
So we're not paying them any money? So
No, sir.
So the only money expended is, payment for you, the salary, and that's it? Or
No.
materials or what?
Yeah, so we still are in contract with On Point as of right now. Yeah, I still get paid under the general fund.
Put On Point on as the managing
Yes.
partner, right?
Yeah.
Correct? Okay.
Yeah. And then remember, Councilman, we still have DOJ, so we still have the outreach portion. And that's why we say the Safer Streets will continue, because we still have the outreach component that we're managing. And that can go until September or even further into 2026.
So our template is like basically where we identify individuals and you self-identify those individuals that would benefit from procedurally what our program is going to be.
Yes, sir.
And it'll both be Dr. Wright and her therapist, correct?
Yep. And we still have 3 part-time city employees that are outreach workers. So they continue to work right now as of today.
Are they compensated through this budget?
Yes, through the city's budget. They receive money from DCJS through Rachel May. So she
I see, okay.
Yeah.
So they reimburse this, the DCGA or JA
Yeah.
reimburses us, okay.
Yep. Yeah. So that will continue through next year. Where we're
Maybe if you could codify that in an email to all our
Okay.
counselors here.
Yep.
So for those, you said 3? There's 3 of them?
Yeah. And 2 are outreach workers. 1 is a case manager part-time.
I want to go back to the number. So before Project HEAL exit the contract, how many participants were in the program that were utilizing the therapeutic services?
So I'm gonna because I'd rather hear from Dr. Anita.
Okay.
She's the lead on this, so I'll have her come up if that's okay.
Good morning, Dr. Anita Wright.
All right.
We have right now 9 out of the 13 young men seeing counselors, therapists. There are 2 of them that are in the Justice Center right now. I'll be starting to visit them this week to make sure that they're all right and just kind of check in. Other than that, we have 2 young men that we have not been able to find. They have a warrant out for them, but we can't get to them yet because they haven't been found. So they're on our list, and that would make the 13.
So with these 2 young men that are in the Justice Center,
Yes.
how long were they with you before they?
I only think maybe 2 or 3 weeks, and then one of them got put into Justice Center. Both of them got put in the Justice Center. We only had seen them. I had seen them for an assessment, both of them, and then saw them for a follow-up, and then they went into the Justice Center.
Now, how often do you get to see them in terms of?
We
your
try to see them
sessions?
once a week.
Once a week?
Yes.
How long?
For an
The
hour.
session for an hour?
Uh-huh.
What are their ages, roughly?
Let's see. Between 19 and 23.
And they have legal counsel as well?
Say again?
They have legal counsel, an attorney representing them?
That I do not know.
Okay, okay.
So what has been the barrier of not getting to 50? Because it's both. What has been the barrier of not getting to 50 participants?
Yeah, so I'll give my piece, and Dr. Anita give hers. I think most of it is the time limit that we had, a year. Finding out, and this is a pilot program, finding the individual, number one, like that was one of the top barriers, is So let's say if somebody's not on probation, we won't have a phone number or an address. We have a name, we have an address that was given to us, but most time guys, they change their number and their addresses more than they do anything else. So it's finding where they are. Then after you find them, making sure they're interested in the program and getting them to trust what we're doing. That's the barrier. And then when they do, now we got to try to get them involved and say, hey, we have group therapy. And that's another difficult part. Now, from there, I'll let Dr. Anita take over because they do the initial assessment and she'll give you more on that.
So we do an initial assessment on them once they come, it really is to see where they are in terms of their mental health, but also to find out whether or not they're going to be willing to engage with the therapeutic process. The ones that I have assessed, there's only been one that was sort of teeter-tottering on whether they wanted to be engaged or not. Most of the others wanted to be once they understood what was going to happen. You know, most young people think that when you say therapy, somebody's going to, brainwash you or something, or tell you you're a bad person or whatever. Mm-hmm. And so what I try to do is kind of explain to them who the people are that'll be seeing them. It does help that all the therapists are Black, and so therefore it's easier for them. They think that that's a little bit more comfortable. The other thing I think is that at first I don't believe some of the credible messengers knew how to engage them into being able to see therapy as a helpful piece as opposed to a harmful piece. And some of that has changed over the time with the therapist talking to the credible messengers about what we do, making sure they understand how it goes, and that they're comfortable with talking about that with the young men.
And this is another observation, Councilman Joe. I think that training is important for the organizations. So they sign on to do the work, but what we found out is they don't have the training or the capability to know how to get an individual from the streets to the straight up, hey, high level shooter, whatever that may be. What's my training on getting this individual to therapy? Some of that might be the person doesn't know how to read or comprehend, or they can read the words, but they can't comprehend what they're reading. So that you lose trust if I don't understand. There's no training for the credible messenger. They don't even know what's going on. They don't know. So I think one of the things we've seen happen is when we talk about hurdles is organizations signing up saying they can do the work, but they're not prepared. So that slows us down because there's many organizations that we worked with, I had to help them hire. They didn't know how to hire individuals. Mm-hmm. On top of literally 2 months in, they're like, I can't find nobody to do the work. Well, you signed a contract with the city. What do you mean? So now we have to so now that slows down. That's a big barrier because now we have to come in and help a contractor sign on. Like I said before, the city of Syracuse, when you all sit around and you vote someone in to do work on pavement, you don't say, hey, oh yeah, we're going to give you the contract and maybe you can learn how to do pavement on the job. And that's kind of what we end up doing. That slowed us down. So, moving forward, when we work with organizations, we want to know you guys know how to do the work. You know how to make sure your individual that you hired are trained to do this specific type of work because it slows us down. And that was one of the biggest barriers in us doing what we do.
Chief, who hired them? I mean, what kind of outline did you have as far as the work goes? I mean, where'd they come from? How did they get in the queue to be hired?
Yeah, so when we contracted with the organizations, we left it up to them.
Previously to contracting with them, how were they selected?
So they get names. I guess the contractor would get named. We don't hire them. The city doesn't hire them. We contract with, Good Life, Project Heal, or whoever it was. And we say, you contract with the city of Syracuse. In that RFP, you said you were going to be able to do the hiring. Now, we would help with some of that because and the reason why I believe we haven't seen guys arrested doing the work we're doing, we did vet them. So the only thing the city was responsible for was putting together a committee to vet the individual. But the training, that's not what we were contracted to do because on the RFP, it stated that they would be able to work with high-risk individuals. And what we found out as we hired these, or we had contracts with these organizations, some of these individuals that were working, they weren't trained to do it. And it wasn't our responsibility to hire them. It was our responsibility to only vet and make sure they didn't have a background, if that makes sense.
No, maybe I'm not quick on the uptake here. We hired them, right? I mean, Good Life, the city contracted them to do this work, right?
Yes, sir. Yep.
So we hired them, the city did.
Yeah.
I mean, so I'm wondering who actually hired them, and then they failed to do the work. And I think this segues way better as far as the doctor goes here. But
Right.
I mean, I'm just wondering how they got to the point where they were hired.
So
And
we
who made
RFP'd.
that decision?
Yeah, so we RFP'd and we had a committee to hire the organizations. Myself, Councilman Majoke, Deputy Mayor Owens, I think it was Pablo from our Harvard Bloomberg, and I think I don't want to, you know what? I don't want to give any more names 'cause I'm not sure of anybody else, but it was a few people on there. I think we had at least 2 council people on there.
So the RFP process was sent out, and when the RFP came back, these were the organizations that had applied. The argument early on that took place is, especially from somebody like me, that we were wondering where Noble, with street addiction.
Right.
And I guess they really didn't want to be involved.
Yeah, he didn't want to do the RFP
He
process.
didn't want to do the RFP process. So with the RFP, this is all we had at that point, and they were
But
selected.
with most RFPs, there's like criteria that they have to meet in order to RFP. I mean, you sat on RFP
I
committees,
sat
we
on
all
it,
have,
yep.
And I don't know what was the criteria in order to be able to offer, or in order to bid on this.
Part of it, from my part, when I sat in that RFP, was that there was a criteria of community involvement with the population. That was one of them. That there had to be experience with dealing with such population, and with Good Life. And I remember when majority of us here thought Good Life, Project Heal, that it was these were the organization actually in the city that were legitimately involved. Now, in terms of the magnitude and the capacity, that's a different story. But at that point, based on the number of organizations that had applied, these were the organizations that could actually do what was stipulated in the RFP when it was sent out.
Yeah. And I mean, that was the only ones we had. I mean, we really didn't have like 30 different organizations. And I mean, what did hurt us is not having Noble Jennings Bay and a couple of organizations that didn't apply for the RFP. They didn't want to do it. And I think they would have, because they've done the work they've dealt with higher risk individuals. I think going into it, and just a reminder, it's a pilot program. So I think it was good what happened, because now you figure out some organizations are in the community, but to specifically work with a high-risk individual is a specialized task. It's not as easy. And then to get that individual, which has not been done, getting that individual to go to cognitive behavioral therapy is a tough go. So we found that out. And I mean, I would hate to, find it out this way, but it's best to find out this way as we move forward and we continue to contract and do the work, to know that there's some organization that does great work in the high schools. They do great work with juveniles, but working with the high-risk individual between the ages of 19 and 27, that might not be their cup of tea.
The other piece is when the contract was issued, part of the stipulation in getting these individuals into the program was that there was going to be a collaboration between the police department, the probation, and all of the other organizations that are involved in the justice process.
Yeah.
Now, I guess my question is, with ending up with only 9 to 13, were these organizations involved at all in making sure that the recruitment of the participant took place?
Yeah.
Because that was one of what needed to be done.
Right.
That it was kind of a choice, but not a choice for some of these participants.
Right.
To be involved in this program.
Yeah.
Right? And I think that's what really took shape for some of us in this body to say, okay, let's give it a shot.
Right.
Because some of these individuals that keep hurting the community need to be corrected in some way.
Right.
Because they can't keep doing what they are doing.
Correct.
They have a choice to go into this program, but at the same time, they had to somewhat be forced into it because they can't keep doing what they are doing.
Right.
Otherwise, the results are not going to be in their way, right? So my question is, what happened with all these organizations that knows these individuals? Were they involved, and why do we have such a low number of participants?
So I think that, and to give the organizations credit, they've done great work, right? Not all of it has been, I would say, negative. I think what helped was having probation involved and having individuals, as you said, like they were made or forced to be a part of the program. And I think, to be fair to the organizations, it's very difficult to take a high-risk individual, and I got his name on the list, and I'm going to go knock on his door and say, we have a program for you. It's not easy, right? I think people think it's easy. And none of these organizations have done this. They've done where they've received names from probation or from the county. But to just get a name from the city and say, I want these individuals are high-risk individuals. Here are their number. Here's their address. You're going cold call. That hasn't been done. Usually with the contracts with the county, they're given the names, but they are already in some kind of supervision.
So in other words, the premise was flawed.
Yeah, so... And
I mean, it's an attempt.
Yep.
But the way it was set up with the RFP and all that, with these different, I mean, the premise was flawed, basically.
Yeah, I think what we should have
done. It was a
done.
bridge too far.
Yeah, I think we should have found 2 or 3 organizations that are really good at it in contract with them, showing that, and again, I'll use Unbelievable as an organization that works with high-risk individuals. I hate to say the name because of what's going on, but Snug does great work, right? They had 2 guys get indicted. That's we know that, right? But if you look at the overall body of work that they've done,
I don't know if that would have been a good selection.
I'm glad we didn't at this point, because they would have been, we would have been have some issues. But I think when you look at overall at the body of work that they do, they work with high risk individuals. Noble, he works with high risk individuals. He might get a cold call, a name that they just pop up and they go to individuals that's not supervised. So I think what we learned is take individuals that are getting supervision, that are either on probation or parole. Those were our success stories. The guys that were on parole and probation that we worked with, they were our success stories.
So with getting them, so the parole and probation part was heavily involved.
Yes.
And just going back to my recollection, that was like a catch, because it came up as to how do we get this individual to be interested, considering that when you think of therapy, it is almost a no-no from these individuals, right? But we said, okay, how do we make sure that they are involved? And the way we will do it is from the entrance, as they are getting out of the facilities, that this is something that they get pushed into. That it was a choice, but it's not a choice.
Right.
If you're gonna go back into these streets, you gotta get in the pathway where you are heading toward better rehabilitation as opposed to just going back.
Right.
In which for them to get out, and then now we are sending organizations to go knock on the doors of these individuals that have not already been enticed from the beginning. It was challenging, but I don't know where the ball was dropped from the beginning. Mm-hmm. And now we are asking these organizations at the end of it to do the work that it should have been structurally set up in the beginning.
Yeah.
Before these individuals get back into the streets.
Right. And I think a lot of it, again, comes from training organizations. We say CVI work, which is community violence intervention, and yeah, we do the work. and we signed a contract, but what does the work look like? You know what I mean? To you, it might look like you work with high school students, and yeah, some of them are maybe high risk. But come find out, you might not work with these individuals. But now you're in the contract, so it's a learning curve. So we might spend 60 days, I would say 30 days or more, just helping some organizations. And I don't want to name organizations. We can talk after. Like some organizations didn't have it. They didn't
We pay them? Did we pay these organizations?
We had to pay them, right? Because we were in contract. So what we did help them. So myself, staff, we helped them hire individuals that has at least done the work or some type of work. I think what was missing in hindsight is the training. So what we talked about in our coalition meetings, we talk about really training organizations to understand what the work is, training their staff to understand what the work is and how to do the work. And the other big part, you said something early, that capacity. Some of the organizations signed on, but didn't have the capacity to really do the work. Or some of it is administrative work, not understanding reallocating money, and we're putting in budget or money reallocation and things like that. That's a lot of red flags for me to say your organization has some capacity building issues going on. And that as a city, when we had our RFP, we didn't put in there that we were helping you all with capacity building. You know what I mean? You signed the contract so you can do the work. Again, I don't want to make it negative because it just took us a longer time to get here. And if we had people trained and ready, we probably would have been in a better place. And just to get back to your question about the 13 and how do we come up with 9 to 13, that was with Good Life. That was with Northside. That was with Salvation Army, sitting in a room coming up with the names because we might have 20 individuals that are doing well. We got people that are working. People over the last year, they've helped people get jobs. We have one in June we will give an award to. He's working at Upstate. He's been there since the entire program working and moving up and doing well, right? So there are some good stories. I think what I want you all to look at is that look how long it took us to get here because organizations, I think they didn't know what they were signing up for. Even though they read the RFP, let's be honest, sometimes you see the money number and that will push you to sign something that you're not prepared to do. But since we've signed a contract with them now, we're going to make sure they're trained. There's been training. There's been different, Yolanda Seegers is here, she with Project Rise. They've had several trainings free where the organization didn't have to pay for them to go to. So that did help the organizations move forward to where we are now.
How many organizations apply for this RFP?
I don't want to give a number. I'm thinking 4 to 7. It wasn't a lot.
So when you look at the organizations, you don't look for the lowest bidder, right? You look at those who you think have a good track record.
Yeah.
Right? Mm-hmm. But the thing is, when you say, well, we're going to choose you, we don't know much about the people in their training, every individual, right? So we don't know. We're looking, we think you have a good track record, and I think you have good people there, and we're going to go with you. So it's nothing to do about money. It's an organization that we feel that has a good supporting cast of workers who understand not just what they learn, but one-to-one basis with individuals in understanding their problems, not making judgment, but listening to them and working with them individually. Am I correct in that?
Right. And we've seen that. And we did that. That's a success, right?
Right.
That individuals that work for the organizations might not have all the training, but one thing I'll say, a lot of them are from the neighborhood. A lot of them have been, their life's been changed, and they really try to, the best they could with what they had. Again, like you said, the capacity piece is what's important. I've been to trainings and conferences all around the country. It is a tough and unique work to work with high-risk individuals that might not want services. And I think throughout the country, and I was at a DCJS conference back in September, one of the best things is using that supervision as a tool, where this individual is on probation or on parole, or what we say in the neighborhoods, they on paper. So now we know that this individual is receiving some type of supervision, and is enticed to go to therapy, enticed to maybe do that because they're on paper and they're
Because the
being
person,
supervised.
right, and because the person who is helping them has lived that same life.
100%.
Okay.
100%.
And again, I think even if these organizations are able to do what they do, I think the buy-in is very important. And I think that's a point where the coercion in the beginning would have been the most effective way to go.
Right.
Because already Dr. Wright said this, out of these 9 to 13 individuals, 2 of them are already in the facility, right? And somehow that structured coercion in the first place, where we should have let them know, look, although we are offering this to you, we are coming to you saying that enough is enough, and you're going to have to do something different than what you have been doing, right, for this to work.
Right.
And I think that may have been a system failure from the beginning to like make sure that expectation was clearly stated. That this is, although this is the choice, it's somewhat not a choice for you, because you have went so far hurting the community that the buck stop here, and we want to help you, and here's how we help you, right? That should have been done from the beginning.
Yeah.
And I think that's where these organizations are struggling, and the outcome would have been a little bit much different, I think.
Yeah, we learned from it, so we do now have, and I will add this to the email we send you guys, so you'll be up to date on what we're doing now. So we do what's called custom notifications now. Now we're piloting it with juveniles, where myself, SPD, along with former Chief Frank Fowler, and we actually, and someone from Syracuse School District, we go to the door, and we give a letter from the mayor's office saying enough is enough. So I think we learned in the first 6 months. So by month 7, I'm like, we got to do something different to make sure they understand that we mean business. Now, the caveat with the juvenile is we know that the system is somewhat flawed with the juvenile, where we only can, hey, we offer services, but we can't threaten them that they're going to go to jail, because they're not going to jail, right? They're in some kind of supervision. But as we pilot it and we see what works with the juvenile, we want to now, in the next few months, do that with the adults also, which is being done by SPD. So just so you know, they do custom notifications, but we want to be a part of that, going to the door, as you said, and really let them know enough is enough. This is the programs we have. This is what we're offering you. This is a pathway out. Now, if you don't make that decision, we can't promise you what your future is going to be. So that's something we learned and that we have changed over the last, I would say, 4 to 5 months.
So On Point is the last organization here with the last contract.
Yep.
So what happened next?
So
Once On Point contract is over, what happened?
our goal is to keep looking for funding. You know, if their contract we're looking to extend to September. I believe Yolanda has been working on a few things, finding out if gentlemen have insurance to cover the continuation of therapy. There are ways, and you know better than I do, that ways we can find some health care to continue the funding. But to get them started, I think the first step is to get them in therapy. And over the next 4 to 5 months, where they don't have to worry about any money and being paid for, I think is a great start.
Yeah, and I, as putting my grant world hat on,
What hat are you putting on?
grant.
Your what?
Writing grants.
Oh, Grant
Yeah.
World.
So putting that hat on, and in terms of the continuation of the program, right? Mm-hmm. If you write grants out there, I mean, data is critical, right? And if you had first initially projected that you are going to service 50, I mean, 9 to 13 is not even 50% of what was first intended, right? And I don't know how we sell that story to a grantor, mm-hmm. that this is an effective program.
Right.
Hi, Anissa Evans, I'm Program Manager in the Mayor's Office to Reduce Gun Violence. So I'm just listening to the conversation, asking the question about 50 individuals versus the 9 to 13. And I just wanted to give a little bit of context and some timeline. So we wrote to the Common Council to ask for everybody's extension the contracts were expiring in either September or October for every one of the contracts that we had. On September 10th, Project HEAL's contract expired, but we did not learn that they were not interested in extending their contract until 6 days later. So there's an abruption of service at that point. Then we had to find a new contractor, which was On Point. So now we have to establish, we have to have conversations, we have to figure out where we are budget-wise because Project HEAL has to submit their last invoices. Once we handle all of that, we write to council and say, hey, can we, have a contract with On Point? We go through that process, which was pretty quick. But the part that was not quick was going from meeting with council on November 12th and actually receiving the actual contract. Our office was not aware they were actually going to allow us to start the contract effective November 1st. Had we known that, we could have implemented the therapist at that time. So now we moved all the way from September 10th to January 27th. That is 4 months of no service for the clients. Meanwhile, the credible messengers are still working with them, and their timeline is steadily ticking down. By the time we get the therapist on board, signed on, contracts in place, ready to rock and roll, we are 6 months out. They are just onboarding, and the other contractors have now come down. So there's no way for us to hold the population of 50 when we've gone from 19 people helping the clients to 9. That is less than half. I just wanted to put that part out there. That is why we had to go from 50 people to 9. We have 3 individuals now helping these people within our office. And the other 6 come from On Point.
So when Project HEAL dropped, it was kind of like a rock being pulled under?
Oh, my God.
Absolutely, it was a cliff. It wasn't even a rug being ripped from underneath us. We fell off of a cliff.
Yeah.
Because again, remember, their contract ended September 10th. We didn't even learn that they weren't interested in renewing their contract, despite the fact that we had written to council a whole month prior. We found out 6 days later that they decided not to do the extension. So that in and of itself is a gap. There's a 6-month gap. You can't ask us to respectfully support 50 individuals with 9 people helping when previously we had almost 20 people providing support to those same individuals. On top of that, the people who we brought on board, as Lateef has said, did not have the level of training and specialization that this clientele would require. It is a lot. So when you come in and you have people who are, they're very dedicated, they want to do the work, but if you don't have that level of training and you're being tasked with 25 individuals for your one particular agency, one of our agencies had, 3 or 4 people that they supported the entire time, which is why our office brought in, we said, okay, we have funding from DCJS, we're going to bring in more staff to support the other agencies that have contracts.
Yeah, that abruptly stopped. I mean, we've had agencies, Councilman, that we didn't see some of their staff since October, and then they reallocated to pay the person more money. I'm like, no, this is some of the stuff that we dealt with, moving forward, just so you know, like the problems we had with some of these organizations that were not capable of doing the work or their staff. And as Anissa said, 6 months window of this not even having a therapeutic process, which is a big part of what we were doing. Remember, when we came to you all, we said CBT was going to be a big part of it. And to have an organization to say they're not going to do the work, that was unacceptable. And I think that's why I started off saying Project HEAL abruptly stopped. And I mean, it baffles me we're talking about people. So these young men started receiving therapy, and then you abruptly just stopped.
Dr. Wright, with the capacity, so you have 4 therapists plus yourself 5, or is it 3 and
4 in me.
4 and you, so
Yes.
5 total.
Yes.
Okay. What is the capacity of these 5 in terms of what can they handle? What is the caseload that they can handle?
At least 10.
A 10 per. Okay. So that's where the premise of
That's right.
of 50. Okay.
Exactly.
That's where it came from.
Yes.
And that still holds true.
Yes.
Moving forward.
Absolutely.
Okay, so as you move forward with this contract, that capacity will still
That's what we're looking
suffice.
for.
100%.
That's what we're going
Yeah.
for.
Just so you know, we still meet with probation we would have met today. We're going to probably meet next Monday. So every other Monday, we meet with probation, SPD, and they will give us more names. So we'll build that number back up. But again, as Anissa said, we're starting from what staff we had to work with. Right now, we're only working with 3 outreach workers for the city moving forward. So we have to be careful of the capacity that we can handle with 3 part-time individuals, but along with very qualified therapists with 5, I think we will get that number back up in the next few months.
So I get my other question would be from the workforce development side of things. You know, out of the 9 to 13 individual, where are they in terms of getting back on track of being functional?
Yeah, most of them are working. We have a few, I would say half was working. But again, out of the 50 that as of March 31st that we can't work with them all, just can't capacity to cover them, a lot of those guys are working. They have jobs. We have a couple guys that are entrepreneurs doing things the legal way. So we have individuals.
Find that for them, or did they came into the program?
Oh
with
no,
that?
they had to get help with getting it. You had a few individuals, I would say out of 50, maybe 5 or 6 that were working, but most of them were just either getting out on parole or probation or been through several services. And the organizations, and I will give a shout out to Good Life, they really did work on getting them jobs. Out of all the organizations over the last year, Good Life did stand out with their outreach workers to help individuals get jobs.
So I guess my question is initially, and this is I take it's a learning journey, right?
Oh,
so
100%.
there's a learning side of things that is heavy here, right? Initially, when it was framed that we wanted to give them incentive, right? So we all collectively came back and said that incentive may not be the best route. Let's go on the workforce development route.
Correct.
Looking back, do you feel it was a good?
Oh, it was great. Because guys wanted to work. They like if you talk, we got to remember it's not a lot of money in Syracuse. The drug game is not that big as people think it is. So if you tell an individual that not making any money, and remember we're dealing with high risk individuals. Either these guys have been involved with some kind of gun or gang. If you give them an opportunity to work a job and they can make their own money, the chances are you're going to get them to do that. Now, we did use the stipend. So we did use a stipend, but I wouldn't say everybody received the stipend. Some of the guys just wanted to get a job. They wanted to work. So when it was presented to them that you can work, I can help you get a job. I mean, we're working with a guy right now through CNY Works to help him get into the Carpenters Union, right? He's excited about that because he wants to work. And he's finding out how much you can make. He's like, I can make that much money? Yeah, sign me up. So I think it really did work to really push these guys to go into the working field. And it has been work. I think, and to be honest, more than education. So if you give a guy a choice to go back to school or to work to take care of, because a lot of these guys got families, they're going to take the job.
So did they end up getting the stipend anyway?
Some
Some
yes.
did.
Yep.
You know, I think maybe looking back, it would have been, you know, we're just legislators, and we thought we were voting for a comprehensive program, and traditionally the city doesn't really I mean, we used to have a welfare department years ago, but the county took over social services. I have a lot of confidence in Dr. Wright assessing and evaluating these men first to find out what their exact needs are. We haven't even talked about addiction. Some might have addiction problems. Some, where they grew, before we get into even workforce development and all that, which is great, they all got jobs. But I mean, until you know what we're dealing with, and I certainly know the bureaucracy and the administrative bureaucracy of the city, but this definitely was a sort of a bridge too far. We should have started smaller, in my opinion, with some professionals assessing and evaluating these folks before we even got into credible messengers and all that. I mean, that's just my opinion. So I'm glad you're on board and your people are on board. And I think maybe then we can make the next step.
I 100% agree with you. Like, I think having people, we've been talking
You
about
never worked for the local government before, right?
Yeah, I have.
I mean,
I worked in state corrections.
Well, you know.
Yeah.
Well, you know how bureaucracy tends to gum up the works, especially for such a complex problem like this.
100%. And that's what just so you know, that's what I've been pushing over the last year. I'm like, we need individuals trained. We need, and what we're trying to create is a collective of academy where we train individuals that come out certified. What I've been sharing is when I worked in law enforcement, you didn't get hired and go to work and they give you a firearm and say, go for it.
All right.
You went through training. Why? Because it's a unique type of work you're doing. So what I've been really pushing moving forward as a city, we won't contract with your organization unless you have a trained, valid group. Just like, can it be done? Yes. On Point is doing it. Dr. Anita is trained. We have therapists, Ashley here. They have trained therapists ready right now to do the work. Sure. And I 100% agree with you. That has to be done when we really changing the thing, this credible messenger. You can't just take a guy, well, I did 20 years in prison, I'm ready to work. No. You need to go through some training. There might be some psychological issues there for the person that's going to do the work with the individual. We need to vet and know all that going forward. So that's a big lesson that we learned over the last year.
Yolanda, are you good? Okay. All right. Are you good, Marty?
I just want to say, I think at the end of the day, what we're doing is we're trying to save lives.
100%.
Right?
Yep.
Every life is valuable. And many people maybe have lost their family, which is the foundation. And some they've gone away from their church. But there are good people who are willing to help them. And I've experienced in the last year and a half, someone who trusts me and needs help. I won't say who it is, but who needs help. And so sometimes as individuals, we're more than counselors. There are people who place their trust in you, and you have to remember that sometimes. You have to sometimes drop what you're doing to help the person. They need food. They need a ride to their mosque, or, I think God puts us in a certain place for a certain reason, and we don't want to forget that. So I appreciate all you do. Thank you.
Thank you.
Yes, Martin. Thank you, Marty. Thank you. Anything else? All right.
You found your hat?
With nothing else, I think that will conclude our meeting. Thank you, Counselor. Thank you, Director Lateef. Thank you, Dr. Wright, and everyone. Thank you. Have a good one.
Thank you.
Yeah.